And if one does go on to a sleep study, in typically the gold standard of treatment is you're put on a CPAP machine. We know the compliance rate is pretty poor. Of course, you're in Australia at the minute, and that's where the invention came out of, one of the best or biggest inventions ever to come out of Oz.
Yeah.
And it was a vacuum cleaner in reverse for the layperson. So basically, you've got a vacuum cleaner which is sucking air, and this is pumping air or splinting air at a pressure to splint open the airways. Compliance is
Yeah.
not good. It's the compliance actually, it's shockingly low. In mouth breathers, it's as
Yeah.
low as 30%. And in nose breathers,
Yes.
it is higher. It's 70%. So on average, it's about 50. What route would you take with your patients? Because I'm just interested. So you have the CPAP
Yeah.
machine there. Is there another route that people can be taking?
Yeah, for sure. So there's multiple different things that they can do. First is assessing whether they can actually breathe. So if they can actually breathe functionally well, and that means basically breathing through your nose, then that's one thing that we've kind of ticked off the list as, okay, that's something that they can do. Then you're kind of looking further back from the nose and seeing if there's any sort of obstructions elsewhere. So if there's obstructions in, say, the throat, they have enlarged tonsils or adenoids, or something like that. As an adult, then you might want to consider referring to an ear, nose, and throat specialist. But there's things that you can do in-house. Potentially like breathing retraining if you're trained in that, or knowing who to send them to for that. There's definitely links between mouth breathing and increased risks of having things like sleep apnea. So trying to reduce that as much as possible. CPAP, yes, it is the gold standard of treatment, but oral appliances have now been shown as another method that you can use for particularly those mild to moderate obstructive sleep apnea cases. So again, it's important to differentiate between obstruction and having another type of sleep apnea, like central sleep apnea, because if your brain is actually not sending the right signals to tell you to breathe, an appliance is actually not going to fix that. So for that situation, yes, CPAP, but there's a ton of other things that you can do for the obstructive. So yeah, the nasal retraining, breathing, oral appliances, and basically correcting the function. If it is that they have a clear airway, but they're just not using it right, there's 100% things that you can do to help correct that.